What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, healthy, and having a great weekend so far. If you had to take a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues and no long-term issues. It is time now for the Saturday edition of the Virus Update for Saturday, March 1st, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of them out there, including H5N1, regular flu, COVID, RSV, norovirus, and a whole bunch others. You need to be informed each and every day of what's going on with these viruses, and that's what I do here on my channel. Want to stay informed? Subscribe down below. Give this video a thumbs up. Let's try for at least 200 like button hits today. Of course, share this video with anyone you know, and leave your comments down below. Alrighty, we do have a few news stories today. Then we're going to take a look at some of our daily data, and we are going to take a look at some weekly COVID numbers as well when it comes to COVID deaths and COVID cases in many different states. Speaking of a state, starting off in New York State today, in East Patchogue, New York. I hope I'm saying that correctly. They're having a problem with dead birds. At least 20 dead birds were found on a small beach in East Patchogue, New York, and are now being tested for avian influenza, sparking concerns in the community. And this looks to be near the New York City area. Take a look at these birds here that are dead. Not a sight that we like to see whatsoever. Not a good thing. Moving on now to this. Washoe County, Nevada has provided an update on what's going on with the illnesses that have been running through their schools there. It's been pretty bad. The Washoe County School District reported updated numbers on Friday afternoon, stating that as of 2:45 p.m., the district increased to 6 schools on outbreak status. In other words, an outbreak of an illness of some sort. And although there was a decrease to 22 classrooms in total, 3 of those classrooms are now on outbreak status for a rash known as hand, foot, and mouth disease. That's not good. And some of the other things that were going on was gastrointestinal illnesses, such as norovirus and, yes, probably some respiratory viruses as well. In California, California reports COVID positivity at the lowest level since 2021 by a hair. Yes, it is the lowest level since 2021. The positivity rate is 2% for COVID, 20.3% for flu, and RSV is at 4.9% at this time. So good to see the COVID levels really coming down in California. Moving on now to this, which is also in California. In Stanislaus County, the public health reported Thursday its first child influenza-associated death of the season, and this is something we're starting to see more of. Now that we're on the backside of the wave, we're on the death wave of influenza. Yeah, we're starting to see more and more kids die of influenza, unfortunately. And we have to go to San Diego next, and I do have a little note here of a page that we're supposed to go into in this report. But before we do that, I think it's important that we read what's going on with all the viruses overall. And in San Diego County, California, this virus season, they have had 24,079 cases of COVID, 228 COVID deaths, 203 outbreaks. Now, that could mean long-term care facilities. That could mean school outbreaks. It could mean a lot of different things. So 203, that's a really high number. Influenza, 34,192 cases, 150 deaths, and 78 outbreaks. And RSV, 4,385 cases, 6 deaths, and 4 outbreaks. Now, I do have in my notes here, we need to go down to page 12. So let's do that. Page 4, 5, 6, here it comes. Page 12. Why do we need to go to page 12? I'm going to show you why. We just talked about a child that died of influenza in, what was that, Stanislaus County. Again, I hope I'm saying that one correctly. Take a look at this. Ages 5 through 17 when it comes to deaths for influenza. Yes, it has now gone up to 5. That's not a good thing. That's now 5 pediatric deaths. You know, anyone under 18 is considered a pediatric death in this case. So, yeah, it continues to rise there. Then we go to Michigan. And in Kent County, Michigan, and I had to make sure this was Michigan because there's also Kent County, Delaware. In Grand Rapids, Michigan, yes, 2 more children have died of influenza, and it does say this makes it deaths number 4 and number 5 of the season when it comes to children in Michigan. So yes, children deaths are going up this year. I mean, there have been a lot of cases of influenza all around the United States. Some that probably weren't even tested positive because they didn't bother to test. But wastewater, it was really high for influenza this year all across the United States. And unfortunately, with COVID, with what it does, with what it has done to many people, how it damages the immune system, there's a lot of people that are getting influenza more severe than they would have if they never had COVID. So yes, it is really sad to see what's going on. And some of these influenza deaths, we don't know about all of them, but some of them are definitely people who are unvaccinated for influenza as well. Moving on to this. In Lancaster County, Nebraska, not to confuse with Pennsylvania or any other Lancaster County. Several states that have it this county. But in Lancaster County, Nebraska, whooping cough cases continue to rise. This is not good. We can see in 2024, September they had 4, October 21, November 20, December had 17. Then came January, 25. February, 29 up until the time of this article, which was posted before the end of February. So yes, that's not good. Over in Ireland, they're seeing a lot of absentees from schools. Chronic school absentees have doubled post-COVID, raising alarms. Yeah, and this is not just something that we're seeing there. We're seeing it in a lot of places since the start of COVID. And, when people get sick with COVID, they're out, in some cases, they're out for many days. So, yes, absentees would go up. And then we mentioned the immune system issue, which we've talked about several times. If you want to learn more about that, go back and look at last Saturday's video. Maybe I'll put a link or something talking about, or like an ending card talking about last Saturday's video, which did showcase what COVID can do to the immune system. People being sick more often, of course they're going to be absent from school. And this probably carries over into work as well. Alright, taking a look at the viral activity levels in Canada. Let's update this because, let's refresh this because it updates at any given time. We saw it update twice in 1 week. The COVID-19 activity level is moderate, flu A is high, flu B is moderate, and RSV is running on the high category at this time. Taking a look at what's going on with air qualities, and I do need to refresh this. I was looking at the Philadelphia area, and there was a reason why. Take a look here. You can see here there is really bad air quality in South New Jersey. Well, there is a reason for that, which is strong winds leading to a wildfire. And let's take a look at something we never usually look at, but in this case it is worthwhile that we take a look at this. Take a look here at this picture, or this loop actually, because I am going to loop this, of radar in southern New Jersey. Yes, that is actually a plume of smoke being picked up on radar. That creates very bad air qualities. And you can see it is just continuously sitting over the same area. Given that we're still seeing high reflectivities, that means they do not have the upper hand on this just yet. Elsewhere around the country, you can see the rest of the Mid-Atlantic is doing pretty well. Until you get down to the southeast, and there are some problems there from about North Carolina on southward. Nothing major. Few minor problems going on in Oklahoma. We'll see that increase later in the week. There's a big threat of severe weather in this area next week. I might actually have to do a video over on my climate channel for that. And still the usual problems out on the West Coast. If it does come up, you can see it starting to come up. California, Oregon, Washington still having some problems at this time. Taking a look at what's going on with EMS in Pinellas County, Florida, we can see there are some sick person calls and a few other calls at this time. Philadelphia reported 796 EMS incidents yesterday. And doing a live look at what's going on in Montgomery County, Pennsylvania. Busy for a Saturday. Wow. 17 calls right now. Respiratory emergency showing up 1, 2, 3 times. Cardiac emergency showing up. Also something showing up here where it says woods fire, field fire. Yeah, it's very windy today, which the wind in this area does create wildfires. Not a good thing. It's been dry. It's been windy. So not a good thing. And yeah, you can see Chester County. You can see all those fire incidents. Respiratory difficulty showing up a couple times. And yes, The old cardiac arrest is showing up here. That's never a good call. Taking a look at what's going on with the hospitals in Pennsylvania, I do want to refresh this. And we can see here there are a few hospitals in southeast Pennsylvania with problems. Several hospitals with problems in the Lehigh Valley. St. Luke's Hospital, Bethlehem campus, is reported to be overcrowding at this time. And up in the Pocono Mountains of Pennsylvania, emergency department at St. Luke's Monroe campus is currently at capacity. I'm starting to wonder if they have released any statements or news reports. I'm going to have to look into that because they have St. Luke's health system as a whole has gotten hit really hard this winter. So I want to see if they've said anything. At this point, they should have just reinstated masking, at least at that health system, because they have been hit oh so hard. Taking a look at New Jersey. Do I detect all green in New Jersey? Okay, except for one specialty issue at Inspira Medical Center in Mannington. Everything is fine in New Jersey today. That is some fantastic news, folks. Taking a look at yesterday in New York State, 1,137 cases were reported, and the hospital situation there was not doing too bad at this time. 793 people in the hospital, but it was noted that New York City, and this is going to refresh on us, New York City was, in fact, increasing. You can see here, still no peak for the winter wave in New York City. I don't know when it's going to be. Hopefully, maybe next week, we will see that New York City has finally peaked. All right, let's take a look at those emergency department visits for those who came to the emergency department diagnosed with COVID in the United States. We can't do all states, but we can do the states that are listed here. And we can see here, the United States at this time, overall, is dropping for COVID. But there's some states that are not. Alabama's one that's dropping. Alaska, kind of bouncing around. You're not really rising all that much, but you're not really dropping. Arizona continues to drop. Arkansas continues to drop. California is dropping at this time. Colorado, you're actually going up slightly. Connecticut is dropping. Delaware is definitely going up slightly. Washington, D.C. is dropping slightly. Florida is dropping. Georgia has gone up slightly. Guam is flat. Hawaii is dropping slightly. Idaho, we'll say it's dropping slightly at this time. Illinois is definitely dropping, as is Indiana, Iowa, Kansas, Kentucky. Louisiana, you're going up slightly. Maine continues to drop after you had a really high peak. Maryland continues to drop at this time. Massachusetts is also continuing to drop at this time. Michigan continues to drop. Mississippi is dropping. Montana is dropping. Nebraska looks like you may actually be rising slightly, as is Nevada. Yeah, that's rising slightly as well. New Hampshire continues to drop. New Jersey continues to drop. New Mexico, slight rise going on for you. New York State, not really trending in any direction. Hard to say what that's doing at the end. Yes, I would say overall it's dropping slightly, but it's a really slow drop. And mind you, your levels are not all that high to begin with. But, hey, still, the fact that it's not dropping faster, a little bit concerning. North Carolina is dropping slightly. North Dakota is definitely dropping. Ohio is dropping, and that's starting to pick up the pace a little bit. Oregon, yeah, I want to say you're starting to drop. Pennsylvania is dropping slightly. Rhode Island was dropping. Now it's leveled off a little bit. South Carolina also leveled off, as has South Dakota. Tennessee starting to level off slightly. Texas just slowly dropping. Utah, flat at this time. I wouldn't say that's dropping at all. And Vermont is dropping faster now. Virginia is starting to drop faster. Washington State is starting to drop a little bit more. Is it? Let's be positive and think that it is starting to drop there more. West Virginia is also starting to drop faster. Wisconsin is steadily dropping. And Wyoming at this time is flat. Alrighty. Moving on now to the latest variants of COVID. I wanted to take a look at hospital capacity, but when I go to the page, when I try to look at the percents are not coming up for some reason. I don't know what the deal with that is. All right, if you did not see yesterday's update, here we go, another CDC page having an issue. If you did not see yesterday's update, there it is. LP 8.1 is now the dominating COVID variant in the United States. It is up to 42% of the cases. It has overtaken XEC, which was at 31%. But I also must draw your attention to this. There's a couple other smaller variants. I didn't mention this yesterday. KP 3.1.1, older variant, 6%. MC.10, 5%. And then you have MC 28.1. Yeah, where did that one come from? Is now at 3% of the cases. And we did kind of have an early indication that we were going to have a new variant take over in the United States. One of those reasons was Pennsylvania had already seen the latest COVID variant, LP 8.1, take over. There you go, right there. You can see in Pennsylvania, it has taken over, and it is all the way up to 47.16% of the cases. So it's really trying to clear the board in the state of Pennsylvania. Interesting to note that. Alrighty, let's move on now to some data from CJS 83172, and we do have a lot of numbers today, so chances are you may see your state listed today. If not, I'm sure we'll get to it at some point or another, but there are a lot of states listed today, and before we do that, we need to pause for a second. We need to have a hydration break. So, if you haven't drank any water or anything in a while, now is your chance to drink some liquid. Alrighty, wasn't that refreshing? Let's get to some numbers from CJS. Starting off with his Thursday update, he does a doubleheader on Fridays. He does Thursday, then he does the Friday report. So some of these numbers are the daily numbers, such as Florida on Thursday reported 531 new cases and 11 new deaths. New Jersey, which was a weekday, 2-day update, 1,061 new cases and 6 new deaths. New York, daily update, 1,367 new cases. Puerto Rico, daily update, 161 new cases and 2 new deaths. Colorado, weekly, a test case positivity rate of 3%, and 7 deaths were reported by the CDC data tracker. Connecticut, this is a weekly number, 479 new cases and 9 deaths reported by the CDC data tracker. Indiana, weekly count, 1,842 new cases and 21 deaths reported by the CDC data tracker. Kentucky, weekly number, 1,389 new positive tests and 30 deaths reported this week. Massachusetts, 741 new cases and 18 new deaths. Minnesota, 1,865 new cases and 19 new deaths. North Carolina, 495 state-reported hospital visits and 20 deaths reported by the CDC data tracker. North Dakota, 197 new cases and 4 deaths reported. 2-week death update there. New Mexico, weekly number, 372 new cases and 7 deaths reported by the CDC data tracker. Ohio, weekly number, 4,141 new cases and 43 state-reported deaths. The CDC data tracker showed 56 new deaths in Ohio, so a higher count coming in from the CDC for Ohio. Utah, 453 people added to their living with COVID tab, and 1 new death there. Florida, daily, this is Friday numbers now. I forgot to put Friday down here, but Friday's number from Florida was 410 new cases and 10 new deaths reported today. One of those deaths came from December of 2022, and you're going to see some more random additions from past years down the line with another state. For the week, they had 3,319 cases and 62 deaths were reported over the past 7 days. The CDC also reported 442 hospitalizations in Florida. All right, scrolling down here. I said we have a lot more. New Jersey, weekday number on Friday was 715 new cases reported today. And for the week, 3,245 cases and 14 deaths reported by the state this week. The CDC also reported 347 hospitalizations in New Jersey. New York on Friday had 1,148 new cases and 7,114 cases were reported there this week, along with 30 deaths. CDC has them at 693 hospitalizations in New York. Puerto Rico, 185 new cases reported on Friday, and for the week, 985 cases, 7 deaths were reported over the past 7 days. Reminder, Puerto Rico is the place we're going to start watching in the coming weeks. Leading up to about Easter, we're going to start watching to see if Puerto Rico has a rise. It can sometimes be an indicator of what's to come for the summer in the southern states and maybe other places. Alabama, weekly number, 186 CDC reported hospitalizations and 16 deaths reported by the CDC data tracker. That might be a 2-week update, he says, as no Alabama deaths were reported by the CDC data tracker last week. That would make sense. Arizona, weekly number, 1,348 new cases reported by the state on Wednesday and 19 deaths reported by the CDC data tracker. Arkansas, weekly number, 12 deaths reported by the CDC data tracker. California, weekly number, 2,119 new positive tests, 691 CDC reported hospitalizations, and 47 new state reported COVID deaths to go along with 146 flu deaths and 884 flu deaths reported since January 4th. Yeah, they're going to go over 1,000 soon for flu deaths. That's a ton of flu deaths in California. Georgia, weekly number, 237 CDC reported hospitalizations and 17 deaths. Idaho, weekly number, 842 emergency department visits, 3 deaths reported to the CDC. Illinois, 508 CDC reported hospitalizations and 30 deaths reported by the CDC. Kansas, weekly number, 8 deaths reported by the CDC data tracker. This week's Louisiana number is 885 emergency department visits and 10 deaths. Mississippi reports 10 deaths this week. Missouri, 176 CDC reported hospitalizations and 29 deaths reported by the CDC data tracker. That's 29. In Montana this week, 217 new cases and 4 deaths reported by the CDC. Nebraska, 330 new positive tests and a 7.4% test case positivity rate and 8 deaths reported by the CDC. New Hampshire this week reports a weekly number of 4 state-reported deaths. Oklahoma, their positivity rate for COVID this week is 5.9%, and 11 deaths were added. Pennsylvania, things continue to be just ridiculous when it comes to hospitalizations. 1,019 CDC reported hospitalizations, the 10th, yes, 10 weeks in a row, over 1,000 hospitalizations, during which time the CDC has reported 11,903 total hospitalizations in Pennsylvania, and they added another 63 deaths. And I gotta pause for a second. I live in the state of Pennsylvania, and I am very thankful that during my period where I had COVID there, it lasted several weeks, as I had the rebound case, I was not hospitalized, because that is a really high number of hospitalizations for my state. Totally ridiculous. We need to raise more awareness on COVID in Pennsylvania. I think it's part of the reason why they brought back weekly COVID reporting in Pennsylvania, because they're realizing that COVID is really bad in our state. All right, moving on. South Carolina, weekly number, 134 CDC reported hospitalizations and 20 deaths reported by the CDC data tracker. Tennessee, weekly number, 230 state-reported hospitalizations reported by the state on Wednesday and 25 deaths reported by the CDC data tracker. Texas, weekly number, 2,664 new cases, 606 CDC reported hospitalizations, and 46 deaths reported by the CDC data tracker. I just want to pause for 1 second. 606 hospitalizations in Texas, okay? Now you're probably thinking, why am I pausing? Texas has a much bigger population than Pennsylvania, and Pennsylvania did way more hospitalizations. That just shows you how bad the state of Pennsylvania is doing when it comes to the hospital situation. Remember, we've been following hospitals in Pennsylvania for several months now, and you saw the hospitals are overwhelmed in some areas. Some areas have constantly been reporting emergency department visits that are full, emergency departments that are full. Well, you can see a reason why. COVID hospitalization is really bad here. Vermont, weekly number, 3 deaths reported by the CDC data tracker, which currently shows 1,276 COVID deaths. That's from the beginning of the pandemic, a slightly higher number than what the state was reporting the prior week. West Virginia, at this time, is reporting 542 new positive tests, a test case positivity rate of 6.77%, and 4 deaths reported. Wisconsin, 840 new positive tests, 4.8% positivity rate, and 20 deaths reported. Alrighty, the CDC added 984 deaths since last week and currently shows 1,221,879 total U.S. COVID deaths. So if you wanted to know how many COVID deaths there have been in the United States reported, that's the number. Now, as we know, some excess deaths could be COVID. There could be many other missed deaths throughout the country that just never got reported. Yeah, the number is likely higher than that. Probably a lot higher. Anywho, there is a note on that, though. In the 984 deaths included this week, 199, see, this is why the number could be higher as well. 199 New Jersey COVID deaths have been added from 2020 through 2022 that hadn't previously been counted by the CDC data tracker. I don't know where they found them, why they were never reported before, but yeah, they're... Alrighty, folks, that does it for the Saturday edition of the Virus Update. If you enjoyed this update, give it a thumbs up. If you want to see more updates like this, subscribe down below, especially if you're new to my channel. Hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. Tomorrow we will have the Sunday wastewater update. Hopefully we'll be able to do that for more than half of the video. It all depends on how much news there is for me and really windy conditions behind me. Sorry if you had to hear the wind today. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Saturday evening.